welcome to this special Mayor's Forum on Healing Communities. I'm Sean Sayre, Executive Director of Pittsfield Community Television and the moderator for this program. On today's forum, we will be exploring the devastating effects of substance use disorder in our community, the steps being taken to address it, and the city's participation in an initiative from the National Institute of Health, which will test the integration of prevention, overdose treatment, and medication-based treatment in select communities hard hit by the opioid crisis. This program will address this issue in 5 parts. And first, I'd like to introduce Mayor Linda Tyer to give some opening remarks, and then we'll introduce our panel and move on with our discussion. Mayor Tyer.
Thank you, Sean. I appreciate your introduction, and I really appreciate your willingness to moderate this conversation and for the expertise and the technology of PCTV to bring this right into the homes of the people in our community. This is such an important topic. Many of us know people who have struggled with, been challenged by, experienced hardships of substance use disorder, and we want to share with the community all of the resources that are available to people who are struggling and to their families, and to inspire the belief that success is possible, recovery is possible, we can help. And there's so much to learn from the expert panelists that are here with us today on their experiences and the expertise that they bring to this very important topic. We want everyone in our community to have a sense of well-being, a sense of dignity, a place where they feel like opportunities are available to them. And recovery is all part of that experience. We want people to find their way to recovery through these difficult hardships. So I think we're excited to have the experts on our panel today, and I would like them to each introduce themselves, speak about their area of expertise, and then we'll just kick off the conversation. So Dr. Michaels?
Okay, thank you for inviting me. And yes, I'm Dr. Jenny Michaels. I'm the medical director of the Breen Center, and I'm also a staff psychiatrist at Berkshire Medical Center, and I'm the community faculty for North Adams and Pittsfield for the Healing Communities study. Thank you.
I'm Raymond Hernandez. I'm a recovering addict. Just here to let everybody know that recovery is possible. There is times where I thought, it was the end of the world, but thanks to the Breen Center and all the staff there, I was able to, and I'm still able to be here today and speak about my past experiences, which have not been great, but I turn them around, and if I can, you could do it too.
Ryan Andrews. I'm a paramedic and president of County Ambulance. Spent many years of having to deal with seeing the opioid epidemic affect our community, and I have the lived experience of spending years as the spouse and father of two people who suffered from opiate use disorder.
Sarah DeJesus. I'm the program director for Berkshire Harm Reduction, which is a program of Berkshire Health Systems.
Darren Derby with the Pittsfield Police Department, 22 years law enforcement experience. Several of those were at the House of Correction, where I dealt with, post-arrest. But now we're looking at trying to curtail our position in the community when it comes to dealing with folks with addiction.
I'm Andy Camby. I'm the director of the City of Pittsfield Health Department. The role of the health department has always been to improve and protect the well-being of our community. So I'm here, happy to be here and to engage in conversations of how we can support.
Great. Thank you all so much for being here today, and I think we'll have a very comprehensive conversation about this with all the expertise that we have in this room. So if we could, let's start with Dr. Michaels. Tell us, sort of set the stage for us, Dr. Michaels, if you can. Why is this an important conversation to be having right now? Why is this such an urgent topic?
That's a great question. Well, we've been battling this epidemic for 25 years. It's a really long time. And it keeps evolving, and our need to evolve in understanding it and treating it and tackling it needs to keep evolving. Just to remind people, 25 years ago or so, it started with Purdue Pharma, a drug company, touting OxyContin as safe and non-addictive, and our government deciding that we were undertreating pain, and doctors complying and overprescribing opioid pills, and that created the genesis, the start of this epidemic. And a lot of people don't know this, but it takes about 2 weeks to become addicted to an opioid. It's a very short time, even less than 2 weeks of regular taking of a pill. Your brain changes, your body changes. So that if you stop taking that pill or heroin or whatever you're taking, you go through excruciating withdrawal. You go through sweating, insomnia, body aches throughout your whole system. You can't concentrate. You can't think straight. And so you know that the only thing to alleviate the symptoms is taking an opioid. So we started 25 years ago with people innocently getting addicted, and it's evolved over the past few decades as we started to understand we were overprescribing. We stopped doing that, but then heroin became prevalent, and people began to get addicted to that. And then fentanyl, which is very cheap, very potent, very easy to make, too. There's no crop production. It takes place in a lab. That started to infiltrate our drug supply in the mid-2000 teens. And with that, we saw a skyrocketing of overdose deaths. Actually, in the last 25 years, overdose deaths have increased 800%. So, why is this a crucial discussion? We just see that over time, it seems to become more and more severe, the drugs that are available, and more lethal. And we need to respond appropriately. Yeah.
One of the things you just said was that it takes about 2 weeks to become addicted to, or to be under that influence of an opioid. Is this something that can happen to anyone? Or is there a particular genetic formula that says that you can or cannot be addicted more?
Well, we know a few things, and by the way, when I say 2 weeks, it's generous. Our brains and bodies respond so extremely to the presence of opioids that even a few dosings alter our internal opioid system. So it could be even less than 2 weeks. It could be a week that we've changed that. People who are vulnerable, though, are people who start early. So the big message to parents is delaying exposure, keeping your kids busy, get help right away if a young person is exposed to any substance. People who are using other substances are more likely to engage in opioid use. And people who have a lot of adversity in their lives may use substances to kind of deal with the negativity in their lives. They're vulnerable. So I always think about, instead of punishing people, we really need to embrace them. We need to pull them in and be supportive, because people are vulnerable. And because of that 1 week or 2 week period of addiction, it's like that. We have to have a lot of compassion, because it could happen to any of us, really.
Are there some basic definitions that we all should know that we're not familiar with when it comes to substance use disorder?
Well, historically, there were a lot of derogatory terms that were used to describe people struggling with the disease of addiction. So people might use the term, junkie, or I'm an addict. That can feel pretty bad. Or someone who is nodding out. They're all different terms that have a negative connotation. I feel like it's most useful to think of substance use disorder as a medical disease, because that's what it is. It's a medical disease. And to use professional terms like someone has a substance use disorder, someone has an overdose, they're in withdrawal. People don't really benefit from being called names when they're suffering from a disease. It would be like someone who had diabetes and perhaps was overweight. We would never deem to say, oh, you're fat in a medical situation. That would be horrible. Why are we doing that with people who have a substance use disorder?
And we know the power of words, right? And knowing that changing a word that we use can make a great amount of difference. And you mentioned fentanyl quickly, so let's delve into that a little bit, because that seems to be what's driving a lot of the danger right now. So when did that start coming into the supply of drugs that are being used, and why is it so dangerous at this point?
So it was around 2014 or 15, we began to see that heroin that was being purchased on the street actually had fentanyl in it. And at this point, almost everyone that we test, anyone who comes to the Breen Center for treatment, is testing positive for fentanyl when they think they're using heroin.
Why is it being used?
Why is it being used?
Why is it being added to these drugs?
Well, think of what's involved in making heroin. You have to grow a crop. You have to, process it. It could take months to get to the end point of making heroin. Fentanyl is made in a lab. That I don't know all the details, but that probably takes a few hours. Okay, so it's cheaper. And it's highly potent. So perhaps serving, or if someone wants to avoid withdrawal or feel euphoria, maybe this much heroin is needed. Probably the amount on my pinky is how much fentanyl is needed. So it's extremely potent. It's inexpensive. It's easier to move around. And for those reasons, it's become the most prevalent opioid that people are using today. I want to add another problem with fentanyl is it's being found in the cocaine supply. So we are treating people who are using cocaine and they're testing positive for fentanyl because they're actually receiving cocaine with fentanyl. And I sadly have had some patients buy pills on the street thinking it was Valium or Xanax, and the pills were actually made up of fentanyl. So that is such an important message, that the pill supply on the street is not safe. And people need to be so careful. And Sarah will talk about Narcan and how important that is, especially in the age of fentanyl.
Right, and we're definitely going to get to that in a coming segment. I saw Raymond nodding his head while you were talking about that. Raymond, maybe this is a good time to give us a little insight into your own personal story and let us know your experiences and how you got to where you were and where you are now.
Well, I want to say I started, my addiction started when I was 16 years old in Springfield, running with the wrong crowd. Basically, not having anything to do. People came around, I wanted to be cool, joining the crowd. Next thing you know, for some weird reason, one of my friends was like, hey, Raymond, I just got away from this home or whatever. They just locked him in, and he had this bag of heroin. And at that moment, I'm not proud of it. I was selling it too. And I just tried it for the heck of it. And next thing you know, all I remember that day is like sleeping. Then maybe a couple of days later, I tried it again until my body needed it. At that moment, it was heroin. But then time passed, I'm like, what? I feel like there's nothing for me to do out here. I'm not gonna keep moving forward if I stay around, this neighborhood. And I'm not saying this Springfield is bad, but the people that I chose, the neighborhoods that I was in, hanging around with the wrong crowd, I was not gonna go nowhere. So I told my two elders, hey, you know what? I'm gonna move to Pittsfield and I'm gonna see, try to live a better life out there. I'm not leaving you guys behind. I love you guys, but this is what I have to do for me. I had to leave people behind in order for me to start moving forward. Well, when I got to Pittsfield, no matter where you go, drugs are gonna be there. If you find the right person, one single word, it will spark up, and I noticed myself in that same crowd again. So, to make the story a little bit shorter, it happened to where my family was suffering, not just my mom, brothers and sisters. My two youngest got taken away by DCF. I'm not proud of it, but I started reaching out. I'm like, you know what? Now that I'm in this hole right now, DCF has the kids. I was thankful, and I still am, that they did step in because something could have been worse. And I started looking at different programs, went to the Breen Center. And all that happened was one of my friends said, hey, Raymond, this is a boxing program. What the heck is that about? I gave it a chance. It didn't click in the first try. This is like my third time. But this time it stuck. It really stuck. It stuck as saying, you know what? I want to move forward. I want to see my two oldest look up to me. I want them to start doing their own life, knowing, okay, things do happen along the way, but it's what you do about it after. What I did about it after is connecting with people, being out there instead of doing drugs, heroin, hiding, until it came to the point where fentanyl was in introduced, and it was a different feeling. I really didn't like it. I didn't like heroin in the first place, but my body needed it. And that's what a lot of people are afraid of, getting off of the heroin, because your body's suffering, you're twisting, turning. What I got out of it that I look at right now that really makes me not go back to it, while I was through the process of getting myself clean, withdrawal, and I did it cold turkey. You know, a lot of people can't do it cold turkey, but I did it for me, you know, just for me, because I know I could do it. My family believes in me, and I did it. And I'm still here struggling. I'm still in the process, but I'm thankful and grateful that the programs like the Brain Center open up their doors. And whenever I spoke to Dr. Michaels, she's my doctor, she always had a great message for me. It's like, Raymond, we believe in you, you know, come back. You know, that's why we want you to come back. If you take a slip or whatever, you know, it does happen. Talk to us about it. We could work it out. And thankfully, thank God, thank you guys, thank you. I'm here right now, and I'm able to share some of my stories. So a lot of the families who think that there's no way out or it's the end of the world, it's really not. You know, there's people out there. Reach out to people, talk about it. You know, I'm not proud of it right now. I'm a little ashamed of it, but you know what? My shame might help somebody else move forward, and you know, just look at themselves. You know what? Wow, if that guy did it, I know who Raymond is. If he's doing it and he's doing good, I know I could do it. And that's my little intro.
Well, I want to thank you for the courage it takes to come and share that story with us.
Thank you.
Because I think it can be a very helpful story for people to hear. And, you know, in that process, were you able to find resources that you needed to help you in that road to recovery?
To be honest, it didn't just stop at getting just help for recovery. You know, like what really motivated me to really get clean was my children. You know, them going through the system, them being taken away for things that they didn't do, suffering for what we're putting them through. And you know what? They don't need to suffer through that. But we could make it better. You know what I mean? We could take these negative things that we have done, turn them positive. Maybe 5 years down the road, my kids are really going to appreciate that I did take that step, that I did step up. I have custody of my stepson, and that's something maybe when I was using, I wouldn't be able to do. You know, 9 months old, here's 11 years old, calling me dad, and it's the greatest feeling ever. And I want to keep that feeling. It's a great feeling to just be able to be there for people, the family that loves you and they need you. And no matter what, you know, some families are going to turn their back on you, but do what you have to do for your family and for you.
Well, again, thank you for sharing that, and I hope that those words can reach someone who needs to hear them as well, and is in that same path right now and is looking for a way to come through.
Yeah, there's ways.
So with that said, we're going to take a short break. We're going to come back to talk about some of the things that are being done here on the ground in Pittsfield, and with a particular program that the City of Pittsfield is going to start participating in called Healing Communities. And so we'll be right back after this short break, and we'll continue to speak to our panel in the next segment. Thank you. Hello and welcome back to this special Mayor's Forum on Healing Communities. On this next segment, we're going to be talking about the Healing Communities program itself and some of the things that will be the City of Pittsfield will be participating in. Mayor Tyre, if I could ask you to start with the first question to Brian Andrews.
Thank you so much, Sean. I think that this is the segments in this conversation today are essential in helping people to understand the continuum of care, the various access points that people might find when they're seeking recovery and when they're seeking help. And one of the things I'd like Brian to talk about is something that he did a couple of years ago with County Ambulance. And it was a state-sponsored program, I believe, Brian, where you were able to get certification to provide aftercare when your EMS crews engaged with someone who had overdosed. And Brian had contacted me asking for some letters of support, and I was proud to support it and really intrigued by this unique component of care that was available in our community. So if you could just talk about that, Brian, and then tell us how now you've moved into this work of healing communities.
Sure. So yeah, unfortunately, just before COVID, we saw approval from the state of Massachusetts Office of Emergency Medical Services to do post-overdose follow-up with our patients who had suffered, an opioid-related overdose, so that we could offer them resources and offer some level of support to hopefully give them the information they might need to seek recovery. Because one of the things that we had found is that although we all are familiar with what's out there for treatment and recovery, a lot of people in the community were not. There were family members who, understandably became frustrated with a family member who was overdosing but didn't know where to turn. And so we got the approval from the Commonwealth to do that. It unfortunately got delayed due to COVID and a few other things, but we're well underway in the process now. And, it's very valuable to be able to give that information. The piece we've just recently added in the last couple months is we have Narcan leave behind kits. So if we respond to an event involving an overdose or any really drug overdose situation, we leave them, we can leave the family or the patient, if they elect not to go to the hospital, with a Narcan kit. And in that leave behind kit, it has information, has a pamphlet that talks about all the places they can go for assistance, because it's not just about recovery. It's also people are suffering from housing, shortage, financial issues, family support issues. So that information is all contained within there, so that they can, hopefully seek out the services they need to help them along that path. And then there is Narcan within there that Sarah will talk about, and also some fentanyl test strips that we'll talk about a little bit later, which are becoming an important part of the process. We also most recently, within the last couple weeks, are doing Narcan distribution from our facility, so that people can anonymously retrieve Narcan to have in their possession, and they can do that anonymously because there's people, unfortunately, due to stigma, that are not always willing to go to a pharmacy and go through that process. And I know we'll talk a little bit more about that later. But this is really all works well with what is this healing community study that we're involved with here in our community. The initiative is one of the National Institute of Health in partnership with the National the Substance Abuse and Mental Health Administration, and they are undertaking a study in 4 different states that is this Healing Communities study. And it's really more than just a study. It's a study and implementing a whole number of initiatives to hopefully come up with evidence-based processes that work to lower the use of opiates in communities and to lower overdose deaths. So the goal of the program is, in 3 years, to get a 40% decrease in overdose deaths. Massachusetts is one of the 4 states. It was Massachusetts, New York, Ohio, and Kentucky. Massachusetts was undertaken because we're in the top 10 states of overdose deaths. And we know how hard hit we are in our community. So our community, as well as North Adams, was one of the Massachusetts communities that were chosen to participate in this. And it's really one of collaboration. And although there's 2 different healing community studies being undertaken with North Adams and with Pittsfield, a lot of the same players are integrated in both of the study groups. A lot of collaboration goes on, and that's really what this is about. Is there are a number of services and treatments out there, but oftentimes the groups aren't working together. And the first thing that occurred is the sharing of data. Everybody was able to share their data, everything from what the hospital was doing, the Breen Center's doing, what we were seeing in the community as an EMS agency, to really get a current snapshot of where we are with the opiate issue. And then we start to initiate some of the processes that we want to put in place, which include prevention, and we'll talk about prevention a little bit later. Talk about stigma. Stigma is a huge in terms of being counterproductive to moving people forward. I unfortunately have seen it firsthand, both from as a medical provider, but also as somebody who's had family members who suffer that people will oftentimes not seek out treatment because of the stigma that's associated with that. And even as much education we do and we try to make the public understand, there's still a lot of work to be done. I was really taken aback a few weeks ago when we started our Narcan distribution program, and I started talking to people about it, and there were still people who I never thought would stigmatize people who had some pretty, straightforward comments that were not helpful. So we've got a lot of work to do in our community on that, and it's already undertaken, the Healing Communities. You've seen the billboards and such that are out there. And then making sure that all the treatment options really are collaborative and coordinated. So a lot of discussion takes place at the meetings about, what different agencies are doing, how they're sharing resources, and, Healing Communities has been really helpful so far, and I'm hopeful that we're going to see that 40% reduction in the 3 years.
And so how long has the program been going on here in Pittsfield, and how long do you expect that it will continue?
We're coming in on the end of our first year, so we've got 2 more years to go. We're part of what was Wave 2. Wave 1 communities started out 2 years ago, so they got underway, and now we're in that first year, and we're really full bore into initiating a lot of the processes and gathering the data.
So it sounds like essentially a learning program in a way. As Dr. Michaels mentioned, it's a fast-moving and changing crisis that we're undergoing. And so this is a way for Pittsfield and Massachusetts and those 4 states to participate in figuring out what are the best practices in working toward solving the problem.
Absolutely. I mean, people should understand we are on the forefront of what the federal government wants to do here. And all the things that are going to come out of this study, it's going to go to the other 50 states. Mm-hmm. So it's really kind of exhilarating and hopeful to see us part of that evidence-based research that's being done.
Yeah. And now to Sarah DeJesus. Let's talk about harm reduction because you're the program manager of the Berkshire Harm Reduction. How does it fit into this big picture that we've been unfolding here today, and what's happening right now?
Yeah, so harm reduction really is essentially reducing the harms associated with drug use. So we've talked about some really great programs for prevention and delaying substance use, some really great programs for recovery and abstinence-based and sobriety. There's a lot of people in between those 2 categories, and so that's primarily the population that we work with in harm reduction. If people are using substances, we want them to be able to do that safely. We want to prevent the spread of infectious disease like HIV and Hep C that often goes hand in hand with substance use. One of the big things for us and how we got tied into Healing Communities is reducing overdoses and overdose deaths. So people who utilize our program and the community in general, we encourage people to carry Narcan to be able to administer that in the event that they are in an overdose situation.
So tell us about Narcan and how it works and what it does to prevent some of the harms and ultimate deaths from overdose.
So Narcan or naloxone is the pharmaceutical drug that reverses an opiate overdose. It's very simple to use. It's just a nasal spray like Flonase or Afrin or something very simple like that. Massachusetts has a standing order for Narcan, so anybody can obtain it, administer it, carry it. One of the great things about Narcan is it doesn't do any harm to someone who doesn't have opioids in their system. So it really, allows people another chance to seek recovery, to seek support. If people, overdose, they don't have those continued opportunities.
So there really isn't a risk to carrying it and using it if you think someone is having an overdose, right?
Right. It's really simple. And like Brian talked about in reducing overdoses, one of our goals is really to saturate the community with naloxone availability so that we can reduce overdose deaths.
And the types of drugs that this would counteract, there's a specific, it's all opioids. There are other types of drugs that you might be overdosing on this won't have any effect on, right?
Correct, yeah. It only works on opioids, which is part of the reason why in an overdose situation, we always encourage people to go with EMS providers, seek further follow-up medical care, because it doesn't, if somebody has taken another substance in addition to opioids, Narcan isn't going to help in that situation or on that substance.
And maybe, Brian, if you could talk to some firsthand examples of how you've seen Narcan work and at what point is it effective in your experience?
Oh, extremely. The number of reversals that we see is astounding. We actually don't have all the data because now so many people do carry Narcan and sometimes don't elect to call 911. We don't always get called to the scene. But we hear anecdotally from people within that community. My first use of Narcan was as a paramedic, and it was somebody in cardiac arrest, and we could not figure out why would this person would have been. They were elderly, but not old enough to really suspect anything, but somebody mentioned they were taking pharmaceutical, a prescribed opiate, and reversed the cardiac arrest using Narcan and brought that patient back. So it's a constant thing. I think it's also worth mentioning that there's a Good Samaritan law in Massachusetts that protects people in the carrying and use of Narcan. Some people were concerned about that. We've had that question posed to us. And,
right.
That you're protected under the law, and you should not hold back because you feel there's a liability. As Sarah said, physically it's not going to cause any problems, and legally it doesn't either.
Yeah, I think that would be a reservation someone might have, is to say, well, what happens if? So it's important to know that having that freely available and used, and maybe part of the idea is also somehow being able to identify when that might be appropriate to think about and to use, because it might not trigger that in most people's minds right now, is to say someone's having a problem, it might be because of this. How do you sense that as a layperson?
Well, as a layperson, you can look for the signs and symptoms, which are pinpoint pupils, somebody who became drowsy and then, slowly became unconscious and then is breathless. But really, anybody who's unresponsive, not breathing, Narcan doesn't hurt them. We actually did a class a couple years ago for a community group on the west side, and the next morning, it was a CPR class, but we talked about Narcan. The next morning, the director of it, was actually on her way to work, saw somebody collapsed on the side of the road, and the first thing she did was administer the Narcan. It didn't work. She did CPR, ultimately saved the person's life. But, it's not going to hurt anybody, so that's why we tell people go ahead and give it, because as Dr. Michaels mentioned, there's nobody that fits that model profile of somebody who's using opiates, whether legally or illegally. So we just know it's such a problem. Go ahead and administer it.
And Sarah, as far as harm reduction goes, again, should people carry this? Should they make it available in their workplaces? What are good strategies there?
100%. I feel like everybody should carry Narcan, and it's very easily accessible. Anybody can come into Berkshire Harm Reduction anytime and get Narcan. Anybody can go to the pharmacy and ask for Narcan. You don't need a prescription for it. The Breen Center gives out Narcan. It's very easily accessible. We've tried to eliminate all the barriers in accessing Narcan.
Very good. Well, I think we're going to take that moment and take our next break, where we're going to transition to our next segment of the program, where we're going to be talking about defining recovery and treatment and reducing stigma, something that had come up previously in this segment in this program. So let's do that now. We'll come right back after this, and we will return with those topics. Thank you. welcome back to the Mayor's Special Forum on Healing Communities. In this coming segment, we're going to be discussing recovery and treatment and reducing stigma, a couple of the topics that we touched on in earlier segments. First, one more quick thing about Healing Communities and the progress of that program. And Mayor Tyre, you have a question for Brian Andrews.
Thank you, Sean. First, I just want to really thank Brian and Sarah for explaining that people like me who are not trained professionals in providing medical care can use Narcan without fear of harm, right? That the idea that someone may or may not be overdosing from an opioid, we can still administer Narcan without fear that we are going to cause harm if it's an overdose from some other substance. That's a really powerful message for people in the community who might have some trepidation about providing care when they're not trained. But I know that Healing Communities has a next step with regard to this work. So if you could explain that as we lead into this next topic.
Sure. So our next step is really the widespread Narcan distribution in the community to just flood the community with it so everybody has the opportunity to carry it with them, because as Sarah said, everybody should have it. And so we're going to have boxes throughout the community, and we've targeted locations initially where you're most likely having people that would probably be very open to taking Narcan, and so there'll be boxes in clubs, bars, places where kids congregate, teenagers, that people will be able to go up, retrieve Narcan for their own use, take it home, put it in their purse, put it in their knapsack, and have it with them all the time. And that's one of the major goals of the program, is to get widespread Narcan distribution. And the good part is we're seeing the community very receptive. As I mentioned, we started distributing Narcan a week ago, and we had within 7 days 108 requests to pick up Narcan kits. So that tells you that there's people out there, and it's interesting the notes we get with the requests. Some said, I'm a teacher and I just want to have it in my classroom, or I have somebody in my family and I think it's important, I should have it with me. They're on opiate prescription drugs. So we're really enthused to see that the community appears anxious to take on this Narcan distribution.
That's great. It's good to hear that the word's getting out, apparently.
Yes.
And that's another reason that we're doing this forum today, to make sure that we get as much accurate information out there as possible.
So similar to a box you'll see on the wall that has an AED, the automated external defibrillator, you're going to start to see these boxes that are called nalox boxes, and they'll be labeled Narcan and available for use. And they could use it at the location if somebody were to overdose, but our goal is for them to take it and have it with them.
That's great. Well, let's move on to the topic of recovery and treatment and reducing stigma. So, Dr. Michaels, let's start with you. Phases of recovery, it goes, as we spoke about earlier, it isn't just a one-time, silver bullet, if you will, take this and everything will be fine, right? The recovery is a long process. Maybe discuss that with us a little bit.
Sure. There's very little in medicine that's like that, first of all. Like if we have an infection, we get an antibiotic and we get better. But the reality is most diseases, are chronic, or we take a medicine or a treatment long term, and addiction is the same way. So it's not so unusual. Recovery is a process. I always say I've never cured anyone, but I can talk about Raymond and like the beauty of someone entering remission or recovery, and that happens all the time with treatment. So recovery is a process, and the process is person specific. So if I said to Raymond, I want you to do this, 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 and this, it wouldn't be his recovery or his decision, and that just doesn't work. And that's what we used to do. We would tell people, go to detox, then do this, then go to these meetings. Doesn't work. So nowadays we understand that recovery is a process, and we need to invite people to pick a menu of options that fit what's right for them. And that may include going to a detox. It may include recovery coaching, which is a newer innovation, and that's having a person with lived experience who helps to guide and support you on your path to recovery, or an outreach worker, an engagement person. Often it includes medication. It may include going to a day program or going to meetings. But the person needs to decide. And the other part of recovery is it's a continuum. This idea that people recover and they never use a substance of any sort ever again just doesn't work. So, for example, in my practice, I have people who've made a decision. They're not going to use heroin. They want to be on Suboxone. We do that, but they're not interested in stopping marijuana use, or they want to keep using cocaine for now. I'm not going to punish or judge them because it's their recovery, it's their decision. And the more we engage people with compassion and kindness, the more likely they're going to stay in treatment.
And it sounds to me like the word transition is the correct word in some ways with that process through recovery, is that it may be that someone is using less or using something different, but maybe not all the way through the process. Is that right?
Yes, and there's a continuum even that we talk about, pre-contemplation, contemplation, preparation, activation, remission, and then there can be relapse. But people are on a continuum, and it's their continuum. I think it's important always to share the facts. Like if I have someone who continues to use cocaine, I'll let them know the dangers, the treatment options, what I might recommend. But I'm going to keep working with them and engaging them and not punishing them or shaming them, because that would be a terrible way to treat someone. And sometimes people stay right where they're at, and some people move over time. I think part of effective treatment is building positive relationships so the people we're working with trust us and know that we have their best interests at heart and that we respect who they are.
Yeah. And Raymond, was that your experience as well? That you mentioned it took a couple times before something stuck for you, different processes, different tactics that you might have taken on that road that you've been on?
To be honest, the thing that really stuck, here and there was that, I'm just gonna do 2 or 3 bags today, and then tomorrow I won't do it, and I usually don't come out like that, or I'm gonna leave a couple for tomorrow. Next, I'm doing the whole thing that same night, and it's just like, what? I'm getting really sick and tired of this, I really gotta reach out to people, and talking about shaming people, sometimes your own closest family members could say a certain word, come out of their mouth, say, you're still gonna be a junkie or whatever. I understand, I'm always gonna be in recovery, I'm always gonna watch my step, but we do need certain family, or every family member at least, to try to be more supportive. Okay, it might not have worked today, me trying the 2 or 3 or whatever, but you know what, the next day I'm just going to try to do less, and it didn't work for me, because me doing less ended up doing more. So I had to talk to my doctor and figure out certain ways where, like, I could go to detox, or you know what, and I'll be honest, I'll speak about it now because there's other people probably went through the same process that I did. I told my doctor, hey, I'm going to go into detox. My choice. She's like, they got certain programs. You know what? I am going to go to detox. Called detox. The person that I spoke to, no names, said that I wasn't eligible, that or like I wasn't basically doing enough or whatever. And it's like, hold up, like I really do need the help. So people that really do are reaching out, whether it be 2 or 3 bags or 10 bundles a day, that's like 30 bags a day. They still need the help. They still need somebody there to at least listen to them and at least guide them through the door. Okay, you know what? This is what's going on. This is the program that we have. We welcome everybody, and not closing doors on people, because a lot of doors have closed. Most of the times we close them ourselves, but we don't need like the other people telling us, okay, you're always gonna be a junkie forever. It's not the case. Just be there for yourself. Believe in yourself, get your own strength, and do what you have to do for you. Stay clean.
And some things clearly worked for you that might not have worked for someone else, and vice versa, right?
What worked for me was mainly reaching out to my doctor, because honestly, there was times that I messed up, and I was ashamed to go back and talk to my doctor about it. I'm about to go give my urine. She's gonna see what I used, but I explained to her, blah, blah, blah. We worked at it, and it was the best decision that I've made, was talking to my doctor, reaching out, understanding that this is not gonna go from one day to another, and just, participate with your doctors, with your mentors, whoever you have there. Be open, like me opening up right now makes me feel better. I start feeling better. Have therapists, you're able to have an outlet, just to let things out. They no longer have control of you. And like I said, even that with family members, saying certain names or downing on you, you know what? Turn that negative into a positive, and that's what I did. I turned negatives into positive. You know what? You're telling me that I can't do this and that. Tomorrow I'm going to show you I did it. Not that I'm doing it, that I did it, and I put a lot of doubts in a lot of people, and I doubted myself too, and I'm really amazed of the progress that I have made. And thank you guys. Thank you.
And Dr. Michaels, talk about some of those pathways that Raymond described there. I don't know what MOUD is, so please tell me what that is.
Sure. Medication for opioid use disorder. So these are medicines like buprenorphine or Suboxone or methadone. And tragically, these medications are stigmatized, and they are the most effective treatments for opioid use disorder. Again, people should have options, but they should be made aware that if you want to have the greatest chance of being alive and being comfortable, because they address symptoms of craving and withdrawal, these are the medications to take.
Why do you think they're stigmatized?
There's a long history of abstinence as the goal, meaning, I'll just
as in the only way that
yeah,
could
and
possibly
I'll use
work.
terminology that I don't usually use, and so you're not really clean. I don't call people clean or dirty, but you're not really clean unless you're abstinent, which doesn't make any sense because all of my patients are clean. I don't have any. That's just not. I don't look at people and say you're clean or dirty. It's just a very weird word to use. So abstinence is works for some people, and it's great for them. The challenge is for most people who are trying to be abstinent, most of them will relapse, and every time they relapse, they're at risk for overdose and death. So now that we have modern technologies and treatments like medication that address craving and withdrawal, and buprenorphine actually blocks other opioids from binding to the opiate receptor, and people are just so much more comfortable. Why don't we encourage people to take medication? That doesn't mean they shouldn't go to meetings or shouldn't get a recovery coach or go to, inpatient if they need it. I think people need all the help they can get, but let's not stigmatize a treatment that's saving lives. I don't know if you want to, do you have comments about that?
Yes, I do. One of the things that, I'm talking about me. All right, so I was in the program of doing the Suboxone strips. So, for a while, doing it, and then I'm like, you know what? I'm going to probably try to get away with, do my medication on these certain days, and on these 2 days, do a little bit of my drug use or whatever. And it just became intolerable. I'm like, man, I'm still going around the same circle. I spoke to Dr. Michaels, and she told me about another medication that they have, which is Sublocade. It's a shot that you get in your stomach, and it lasts for 30 days, which was the best thing that I did. Because now I'm not taking the strips and be like, oh, I'll do it for 3 days, and then on these 2 days I'll do it and come back to it. Like I said, for everybody works different ways. But I think for me, in order for me to still stay around and doing what I had to do, was give this other medication a chance, which I did, and like I said, it's been the greatest thing ever. I'm not withdrawing from anything. I'm feeling great. I'm feeling positive, and it's great for everybody out there to look for what's best for them. Like I said, the strips they work, but like I said, I was still having that mentality of, I'm gonna get over, and I was really getting over on myself, and the Sublocade just really took all that away and got me back on track.
That's great.
Thank you.
And so let's talk about how to reduce some of the stigma, and we'll open that up to Brian and Sarah. Obviously it's harmful, and it sort of reverses all of the work that goes into what we're talking about here today. How can the public listening today change their thinking pattern about how they think about this problem and use different words and not just the words, but the thought pattern behind the words
Right.
to reduce some of the stigma.
Yeah, I think it's important that people get an understanding of what this is about. It's a disease. It's not, a choice somebody makes. In the case of my family members, one had a surgery, the other one had a broken back on prescription medications.
Mm-hmm.
This was before doctors had a firm better knowledge of how to wean people off them. They immediately stopped it, and then they got the classic, pill seeking and went down that road. So it's important people understand that, being a disease, the other stigma that is frustrating is the one, as you hear, the stigma of being on medication is your recovery. If that's what it takes somebody, it's not a replacement. People think you're replacing one drug with another, and you're not. You're taking away the cravings and being sick. And anybody who suffers from the disorder will tell you the worst part of it is the withdrawals and the sickness that you get if you don't get the drugs. And so it's important that people understand that and don't pass judgment on that. And that includes medical providers. Unfortunately, I've seen it on the other side of the fence. As a first responder, you sometimes see people who are first responders who get frustrated, understandably, because they're responding to the same person, for multiple overdoses, and they can become what I call compassion fatigued and don't have a lot of compassion for people. So that's something we have to monitor on a regular basis with our people. And the other side of that, I've seen in the hospital environment. My son was a type 1 diabetic, and when he was actively, addicted, he would not take care of his diabetes, and we'd take him to the emergency room in, diabetic ketoacidosis. And I had one time where a nurse told me, no, that's his withdrawal. And I go, no, I know this kid. That's not his withdrawal. He's got it. And ultimately, he was in ICU being treated for his diabetes. But it was somebody who, unfortunately, had developed compassion fatigue. I'll just end up by saying the reason my son finally sought recovery, I believe, is the last time I took him to the emergency department, and the physician who was on was very compassionate, very understanding, and had a great talk with him, and was very sensitive to what he was going through. And it was shortly thereafter he sought recovery.
And Sarah, talk about harm reduction and stigma and how those two things are related.
Yeah, harm reduction itself often has stigma that comes with it. It's a misunderstood program at times where people have the assumption that we allow people or encourage people to continue using drugs. We're part of the care continuum as well. We, help people get to detox if that's the route that they're looking for. The biggest part in reducing stigma and harm reduction is building trusting relationships with people and allowing them to have open, honest conversations so that they're not ashamed to ask for help, so that they're not ashamed if they use and they have to go, leave a urine sample. Just those open, honest conversations, because people who are using, pretty much everywhere they go, they're told, you got to go to treatment, you have to stop using, you have to do better. And when they come to harm reduction and we ask, what do you need? What can we do for you? It really shifts that narrative and puts the control, puts the ball in their court and allows them to think about how they are responsible for, the path that they're going to take. And it's really accepting people for who they are and not how we want them to be. It's hard sometimes to not put our judgments and our intentions on other people, but really accepting people for the way they are.
Yeah. And a big change in the way that we think about this, the entire public, really. So we're going to wrap this segment and take a quick break. And in our next segment, we're going to be talking to folks from the city of Pittsfield and how the partnership with the city is integrated in this entire plan and initiative. So we'll be right back after this. To the special Mayor's Forum on Healing Communities. I'm Sean Sayre, And in this segment, we're going to be talking about the City of Pittsfield's partnership with the topic that we're talking about today, substance use disorder and healing communities. And Mayor Tyre, talk to us about how the City of Pittsfield got involved with this initiative.
Thank you for that question. And I think it's a sad statistic that brought us the benefit of this Healing Communities initiative. We are a community that has a very high rate of overdose and fatalities related to overdose. And so the Healing Communities initiative wanted to identify those communities that were experiencing those high rates of overdose, substance use disorders, and fatalities related to substance use disorders. So it is a sad statistic that brought us to this point, and now we have this incredible initiative bringing all of us together, including the City of Pittsfield, to try to bring as much care and health and well-being to the people of our city.
So let's talk about some of the collaborative efforts that are happening here for positive outcomes on what brought us here, right? And we realize that this is a difficult situation for our community. Maybe people living in the community don't think about it every day, but it's there and it's a real problem. So talk about some of the collaborative efforts that are moving forward to address this.
I really appreciate this question because I think in my role as mayor and as someone, sort of leading an organization, a government organization, I didn't view initially our role or that we had expertise in contributing to helping our community overcome these challenges. And I admired from afar the people like Dr. Michaels who were providing this incredible care, and the Breen Center and all the other organizations that are available, harm reduction programs, and what Brian was doing at County Ambulance. And I realized that this really is a public health crisis, and that we have a public health department, and that this is also often something that our Pittsfield police officers and firefighters have to deal with when they respond to calls, people who are overdosing. And so I felt that we really needed to become more engaged in this issue. And so we really have undertaken a number of pretty creative ways to start being part of the solution, to be more engaged, and quite frankly, for all of us in government, learning from the experts that are here with us today about how we can help. It's not necessarily our wheelhouse. Providing recovery programs and understanding the medical disease of substance use disorder, it's not our area of expertise. But we can't any longer be on the sidelines. We have to engage. And so that's why we've undertaken a number of initiatives.
Okay. And let's talk about the addition of 2 licensed social workers to the City of Pittsfield, one in the police department and one in the health department. How does that contribute to solving some of the problems that we're talking about today?
Well, I think there's a number of ways that it contributes. First, I view both social workers, the one that is with the Pittsfield Police Department and the new social worker in our health department, as educators, helping those of us who are in government understand how we can help, educating us on what we ought to be doing as a government body to help join in this effort. So I think the social worker in the Pittsfield Police Department is invaluable in that providing that education to our police officers, providing education to the 2 co-responders that are responding to calls with our police officers, and really the role, in my opinion, of taking away the stigma that substance use disorder is a crime. It's a medical illness, as Dr. Michaels so eloquently explained to us in an earlier segment. And so providing our police officers and our firefighters with this ability to understand that this is not a crime, that it is an illness, and while many people's first resort is to dial 911 when they are afraid and they need assistance, our police officers and firefighters are learning how to be compassionate in these instances where they arrive in a situation with the help and education of our social workers and co-responders. And in the health department, we're hoping that our social worker can support our director of public health in designing programs, joining up with harm reduction or joining up with the Breen Center to find ways to execute on how to provide care. And so Andy and the social worker and our public health nurse have started to identify areas where we can join this effort. And Andy and Darren will talk more specifically about the things that they're doing to help us become part of this solution.
Yeah. Great, and let's do that right now then. Let's open with Andy Canby. Tell us a little bit about what you're doing in the health department of the city of Pittsfield with regards to the topics we've been talking about today, and specifically where the partnership comes in with the city of Pittsfield, the health department, and some of the other agencies we've talked about.
Thank you, Sean. Well, first, I want to say thank you to Raymond for sharing his story. I'm proud of you. You're an inspiration to the initiatives that we want to do in the health department and work with the other agencies as well. The role of our social worker, and we actually have 3 staff, new staff. We have the community health worker, a social worker partnering up with our public health nurse. And what we want to do is expand our services to join and support the agencies that are here doing the good work that they do. We want to be that bridge for our residents to empower them, to follow up with them, to make sure that they're getting the resources that are available. So our social worker, this is their 2nd month in, has been going out to locations such as the Christian Center, such as the library, senior center, out in the community, and engaging with residents and participating in conversation of, okay, these are the resources that are available. We're here to support you. And we, as the public health department, we also want to gain that knowledge of what are the challenges that are facing our community. There's a lot of social factors that have contributed to the struggle that we're all in, and we need to own that struggle, and we need to help find solutions and help empower our residents to get the assistance that they need. So it's a new initiative, and I'm very happy for the support that we have from everybody, from our residents, from our administration, from our Board of Health. It's a good initiative to be part of. And so the same with our community health worker and our public health nurse. We're other things that we do are we have started to do is the public health wellness clinics. We're hosting some in our department on Wednesdays in the afternoons, where anybody can come into our public health department, and we have a section with our public health nurse side where they can have a one-on-one conversation with our social worker or with our community health worker to discuss anything. You know, we originally we were in inspectional services that we work with housing, and we want to be able to support people that are dealing with housing issues, but also that want to gain access to resources. And so we have been having our staff member get that expertise, get that knowledge to be able to share that resource to our residents. And also our staff members are participating in the coalitions that are happening in the county. And having our staff member participate in the Pittsfield Hub, participate in the Youth Coalition, participate with the Healing Communities, it's important, because then we can identify how we can help as a city government, and also how we can talk about the good work that's being done, you know, and see the good work that's being done. So there's a lot of work ahead of us, but I'm eager to start, and you know, I'm hopeful for the community that we can all come together. As what we've heard from all these segments is that it's a problem that we need to work together to address.
And Sean, I think if I could just ask Andy to talk about how we also have the Narcan kits in our public health department that people can access, whether it's our own employees or people who stop into the public health department for other kinds of services. Can you just talk about that for a minute, Andy?
Right. So with our staff in our public health section, we have had them do the training for the Narcan and have them also get the kits to be able to distribute them. Again, the more people that, as Brian mentioned, that we can get involved to distribute and give that education around it and reduce that stigma behind it, the more important the work will do.
Thank you.
And it sounds to me like, again, getting the idea in our minds that this is a public health issue, right? Traditionally, we think of a lot of this as being more in the law enforcement area, and that's where we're going to talk to Officer Derby about, but it really seems to have a balance of both for the city of Pittsfield. Addressing it as a public health issue and all the resources that the health department can bring to bear. But then also, Officer Derby, you're on the front lines of this, and your colleagues are on the front lines of this crisis every day. Talk about the role of law enforcement in this crisis that we're in the middle of, and how you direct a particular issue to the right department in a situation that you might encounter.
Yeah, thanks again, Mayor, and the rest of the panel for allowing me to sit here. I think in law enforcement, we run into a lot of difficult situations, and much of what we do is dictated by policy and what mass general laws say we can and can't do, and a lot of times there is a lot of gray area and not a lot of answers. And Brian, being in this field for a long time, and the medical field, gosh, what was it, maybe 10 years ago, somewhere around there, where they fixed it where if somebody was to call for an overdose and we responded and they had drugs for personal use there, prior to that change in the law, it said, hey, police, charge them with that. And then thankfully somebody decided, hey, that's not a great idea because that's stopping people from calling 911, and we were dealing with, open the door and lay people out on the sidewalk because they didn't want us in their house. So we saw, that's really, I think, when we started to see the change, finally, after 20 plus years of dealing with this epidemic. And to me, it's been slow. Especially on the law enforcement side, when it comes to our responses to the pandemic and the epidemic, when it comes to the overdoses and the drug use. And the things that I think we struggle with in law enforcement is we just don't have that direction. There's not enough. There's still too much gray area in the law. But with all of these local organizations and committees and programs, we are now sitting on the boards. We are now participating in these discussions weekly, if not monthly, to find out that, hey, when we go to a call, here is what your options now are. We didn't have that as much before. Many of that was because we didn't participate in discussions. We didn't have the knowledge of pamphlets and handouts. And again, like Andy had said, that, there's, in the rest of the panel, it's all about collaboration. And it's all about playing well with others and accepting others' ideas and saying, hey, you know what, yes, you can arrest them, but maybe here's another alternative. And having those alternatives at our disposal has been a huge benefit. And as the mayor said, having our co-responders and social workers, where before we would show up and we wouldn't know what to do. And now we have co-responders that maybe have a little bit of addiction education in their background or work with programs with addiction. So we can say, we don't know what to do here. Hey, we can help you, and leave it with them. It's not really something that law enforcement is accustomed to doing.
And I would think
but we're learning. So.
Training is probably also key, right? And
yeah, so training
in new techniques and
we've
again,
always
social worker.
Yeah, I mean, we've always done training. Training in law enforcement is just it happens every day, but never to this amount have we had training when it comes to mental health and addiction and how to respond. And obviously we're thankful for that because it's making our job easier, especially when we have the co-responders. So instead of us just showing up at a scene and trying to explain to the family, now you have the ambulance service who has the aftercare, who can follow up with them. There's many communities on the other side of the state that have had such initiatives, but to have that, and now it's less burden on us, but to now collaborate with other programs like the Behavioral Health Network, where even if there's an officer on scene that has no idea, they know that I do, and they will call me 24/7 and say, hey, we have this subject here, or this person that's wants some help but doesn't know what to do. Okay, put me on the phone with them. All right, hey, listen, I'm going to make a phone call. I'll call you right back, and I can have somebody within an hour. If they don't want to be local, within an hour, vehicles here to pick them up and bring them to a different facility. So, and I've done that probably a dozen times in the last couple of months, and now hearing from those same people, that thanks a lot, it worked. I think that is huge. And knowing that we can go in that direction, and it's not necessarily a criminal matter.
Yeah, and I'm hearing from both of you, it sounds like there are resources available now that weren't there a short number of years ago.
Sean, I think the other point that I want to emphasize from the city's standpoint, which has been part of this overall conversation, is that any touch point that we can help someone, like the touch point might be Darren, or a call from a 911 call, or a touch point might be a parent that comes to the public health department. So anytime we can expand those touch points is helpful to being part of this solution. And one of the initiatives that I know Darren and Andy are both involved in is the Hub initiative, which is another part of the comprehensive strategy that we're all trying to bring to our community in terms of providing this type of care. So if the two of you wouldn't mind talking about the Hub, I think that's a very interesting model that we've replicated here.
Yeah, so the Hub, and if you don't mind, I'll go first. And so the Hub started out in Chelsea. It was called the Chelsea Hub, put on by the Chelsea Police Department, run by them. And they really they put together a roundtable that met weekly with individuals that were maybe putting a strain on the system, or that the police were constantly dealing with, or the schools or the hospital. There was some acute something. It was a high level of acute danger that was there for that person or family, and so they had put together a roundtable of organizations, from housing to elder services to school to EMS, police, fire, code enforcement, health department, and you name it, it's endless. And they would come together and they would present cases on a weekly basis. And their goal was to, within 24 to 48 hours, hook that individual or family up with services that they have yet received that may lessen the burden on whatever it is that they are having to deal with on a daily basis. And that in return slows down the number of calls for us, for EMS, for the hospital, for the ER, whatever it may be. And it was proven to be hugely successful, and to the point where it's now statewide in most major cities. So the Pittsfield Police Department hosted the training, we brought it in, and since have kind of evolved it and turned it over to the Second Street Second Chances, the Sheriff's Office, and glad to see that the Health Department is on that.
Yeah.
So yeah.
Yeah, it's a great benefit to be part of that roundtable, because as the health department, we also have our networks that we can share with someone that is in crisis and help identify how we can help out. So, as Darren said, that it's great to be part of that roundtable.
Yeah, having the collaboration probably makes a big difference in knowing that you can maybe get to the problem before it gets to the acute stage.
Yeah, and we have, most of these organizations have been around for a while, but never really weren't intertwined. And I think just calling, just saying, hey, this is what we're doing, we need you. But it also holds those same organizations accountable. So it's kind of nice. So that whatever, if there's a team of 4 or 5 different agencies within the county that are now attached to this person or family, they just don't hey, we've got you hooked up to services, bye, thank you, they stick with them. And they can always come back and be brought to the panel again if something hasn't worked out. But it really has, we've had tremendous cases that have just been successful.
And I think one of the things that to me was really powerful about the hub model, if I've understood it correctly, Darren, is that a person or a family is identified, there's a discussion about what type of care is needed, and the care is brought directly to them, as opposed to asking a person who's in crisis to go to the Breen Center and then go to housing, and then if you need help with food, we can get you food pantry. It's where, have I got that right, Darren?
Yeah, the whole table comes to you. We basically do a knock and talk within
Right.
24 to 48 hours, try to get it done within 24 hours so we can get everything else in motion. Yeah, it really, and I think that's the most effective part is sometimes you have to meet people where they are, many times, and to expect these individuals that are in acute level of risk to go from one facility and organization to another and to follow up, it's not realistic. So
Sean, I'd like to bring up a recent success story of the Hub that I think really demonstrates how that collaboration works. And it started out the day after the big snowstorm we had a few weeks back. And one of my supervisors came to me and said, I'm really concerned about this homeless individual that camps out. He's on the lower edge of the river, and we've been dealing with him a few times for medical problems. He's now not really able to walk very well, and we're concerned the rain's coming on Friday that he's going to get overcome by the flooding. So we were fortunate that this was on a Wednesday. We had a Hub meeting on Thursday, so I brought the case before the group, and the collaboration was amazing. We immediately, Lindsay from the Second Chances from the Sheriff's Office immediately joined as a kind of a co-leader with me on the team to approach it. So the health department, their social worker, and the public health nurse says, we'll get involved, we can help. And meeting was over. We went, visited the site, found out, okay, he's in the hospital right now. The public health nurse and the social worker went to the hospital, approached him initially, talked about some options, got him into a skilled nursing facility, and now he's understanding. He has some developmental disabilities. He has some substance abuse issues with alcohol, and now medical problems. They were able to help him understand some of the resources for housing that are out there, and it looks like we're going to have a success case that we had a guy who was living in a tent on the river in very unsanitary conditions that now will be housed and get treatment for his medical problems. So that, that was something that that's how the Hub works. Yeah. Somebody says, hey, I see somebody in danger here, and let's find a solution to it. And so it says, like Dr. Michael says, we're evolving in this whole thing as we go. Mm-hmm. And now that evolution of the health department, who 10 years ago was never really involved in substance abuse problems in the community. Now they're on the front lines with us, and they have some expertise that they can bring to help. So
that's a tremendous outcome.
Before you go to break, if that's the time, and to mirror what Dr. Michael said is, and it's the Hub, we don't force people. You can't force people to, hey, this is what you need to do. And it's really giving them the information, the education, the knowledge, and saying, hey, we care. And that's why we're here. That's why we're in front of you. Don't think that you're bothersome. And if today's not the day, that's fine. Let's exchange phone numbers. And more often than not, I get their phone numbers, and they have my phone number, and then anybody else that's sitting on their round table, their personal round table. And it makes it so much easier. And again, just to be able to have that makes those success stories much, much easier. And they're not all perfect, but they all know, I thanks so much for, sticking with me. I've never had a group of people or a person, come here every day and check on me. I've never had that before. So it's
just tremendous that the collaboration brings those outcomes, right? And that's the ultimate goal. Thanks for all of that, and we are going to take one more quick break, and when we come back, we'll have a roundtable discussion here to talk about the types of things that you might be able to do for a family member or for a friend or a loved one. So we'll be getting some tips and expertise from our panel, and we'll be right back in just a moment after this. to this special Mayor's Forum on Healing Communities. And we've reached the point near the end of the program where we're just going to do a quick roundtable discussion with our panelists here about, what can you do if you come across a situation like this in your own personal life with someone that you love, a family member, a friend, a colleague. If someone is going through this, Dr. Michaels, where does that person start?
I think people are very uncomfortable in general confronting people they care about. So I really encourage them to think about it case by case. And whatever they do, it should be in a very loving, open way. This just came up with someone I know yesterday, and we talked about how would they feel if they never said anything, and this person just got worse and worse. And that person then said, well, that means I need to say something. And it was very open and loving. I care about you. I've been thinking about you, and I noticed that you drank a lot and were slurring your words. And so it was, we called it the kiss, the kick. And so a lot of kissing and maybe one kick. But it's different for everyone. And sometimes you need to go and ask other people, like at Learn to Cope. That's a local free group. Other people who struggle with that same question might have some suggestions. There's no one right answer.
Yeah. And that can be a very uncomfortable situation for someone to be in, right? Is to know whether they should speak up or say something because they've noticed something, and maybe they don't want to damage the relationship they have with someone, but they probably have to ask that question. If I did nothing, then what happens?
Yeah.
Right.
Yeah.
Okay, access to services. We've talked about that quite a bit here today, but where can people start to find resources on that? If this is the first time they're thinking about it, or it's come across, and they say, okay, now I really need to know more about this right away. I need to learn everything I can. Where's my first point? Where do I ask those questions?
I think, Sean, there's been a number of links that we've been putting up during the break,
right,
so they can go to those. You can go to the Healing Communities website, which has a lot of resources in terms of information, even what Dr. Michaels was just talking about. When you think somebody has a problem, here are the things to look for. This is how to approach them. This is language to use that would be preferable and not really start things off on a wrong foot. Berkshire Harm Reduction, you can go to the BHS website, and they have a number of pieces of information there. Certainly the Bureau of Substance Abuse in Massachusetts, BSAS, you can go to the state website, and they have links to 800 numbers to call for immediate help, lists of recovery and treatment centers so that people can look up and see the availability and close and long distance, and all the different services that are available. And we also have the BOPSI website here in Berkshire County, which lists a lot of the local resources.
Sean, could I just ask the panelists and even Raymond, what are some of the ways that people who want to help, who want to offer help, what are some of the words that we should use? I mean, literally give us a script so that we can be more helpful and cause less harm. How do we do that?
In my experience, I've been across, a lot of people who, straight up with the, hey, he's a junkie, these kind of awful words, and those are not really uplifting words for somebody that's reaching out for help, So, okay, I'm trying to reach out for help. Let's say a family member, hey, I'm going through this. Oh, you know what? Those people are junkies, even though they're not referring towards me, I'm looking for help, they're addressing it towards somebody else, I'm going to shut down quick because, okay, you're talking about this person like that. What about me? I'm your brother, your sister, your loved one. They're going to shut down, you know what I mean? And a lot of the times what I've done is, even though it hurts, reached out to my family. Hey, this is what's going on. One of the toughest one was telling my mom, hey mom, I'm messing up again, blah, blah, blah. And just having that open communication is the greatest thing, because she looked at me, and she was like, Raymond, I believe in you. Oh my God. And I swear to God, that's what I really needed to hear. My mom telling me that she believed in me, like I said, a lot of family members could be hurtful, but sometimes we really do need to hear something that's gonna crush you for a bit, but it's gonna open up your eyes. We just gotta use different terminologies to refer to the drug use, okay? Because I'm honestly, I'm not proud of it. I'm glad that I took some experiences out of it, because if I don't take any experiences, I'm not gonna keep on remember. I'm just gonna keep digging in myself in that same hole because I didn't learn nothing. Now that I'm learning little by little, opening up to and talking about, I work in North Street, so I see a lot of people that really do need the help, really do need somebody to, hey, let me speak to them for a second, which I have. Hey, it's kind of uncomfortable for them, but hey, do you have family members? Hey, have you thought about, looking for a place to stay? I work for these people, but we could help you. Just giving them an outlet, just having a little conversation, then just throw it in about, hey, are you looking for recovery? This was what worked for me. And honestly, what worked for me was reaching out to the Breen Center. And like I said, it came from one of our unexpected friends who, hey, this little orange pill, but, huh? For real, they got that? Then I gave it a chance. I didn't really get it the first couple times until it was my choice. This time was, okay, I've been back here, this and that, for everybody else, because I'm trying to please everybody else. That's me. I gotta please me. I gotta be my own person. I gotta find my own place in this world. And where I found it, and it's more peaceful, is clean. Being clean, being able to just interact with people and just being able to guide them towards a better tomorrow, a better future, because we all have a future. We all grew up. I want to be a teacher, a lawyer. I wanted to be a lawyer. You know what I mean? Things don't go as planned, but that doesn't mean that it's the end of the world. We still got other places where, okay, I started here at the bottom. 2 or 3 days later, I'm gonna be in the middle. You know what I mean? It depends how you chasing life. And right now, I'm chasing to live. My kid's mother passed away, and I'm choosing to live. You know what I mean? She didn't die of an overdose or anything like that. God bless her soul. But it just opened up my eyes. You know what? I want to live for my family. I want to live for me, and I'm gonna choose to be clean and be happy. And that's what I choose right now, to talk to people. And hopefully, as of now, even telling my story. Like I said, I'm not too proud of it, but hopefully it might help somebody to, instead of going down the wrong path, start, okay, you know what, let me sharpen up. If this guy could do it, because a lot of people know me, not for being bad, but, if he went through this and, he's seen outlets and he's seen people that he could, move forward, you know what, let me give it a try. And hopefully it opens up somebody's mind. Be there for their family and be there for them. Be there for you. Be there. Be present. Just love you. Love yourself. We're all wonderful people. Everybody deserves a chance.
Sounds like all of those support options all the way along the path are so important.
Yeah, and it's such an honor to be here with you and hear your story, Raymond, and to know that you are healthy and well, and you're an inspiration to families and to people that you interact with, and you share a little piece of yourself to those people that you see on North Street or people listening today. It's a really powerful message. It's an honor to be here with you today. Thank you for joining us.
I appreciate it. Thank you for having me.
Just to emphasize a little more, and it's always amazing to listen to success stories, especially when they're right here in front of you. When I, or in law enforcement, we're dealing with the families, what we end up dealing with is a lot of times it's the first time the family members have recognized that, hey, oh my gosh, like my son just overdosed and he could have died, and they're going through more anxiety than I could even imagine, and they're lost. You see it in their eyes. They don't know what to do, and I think just giving them, and maybe as Dr. Michael said, just having empathy, and talking to them about, listen, this isn't your son, all right? You know your son. This isn't your son. This is the drug. This is what the disease has done to your son. Yes, you don't understand it, and yes, you probably hate him more than ever right now. You're not hating him. You're hating the drug. And hopefully that allows them, when you're having those conversations, to go, oh, yes, he's still my son, or still my child, still my daughter, my loved one. And having them be able to recognize that their loved one is still there, but right now it's just overtaken by the drug, and showing them the continued compassion, and just letting them know, listen, I love you, but here's the reality, and like Raymond said, just you have to be brutally honest sometimes. But as I tell the parents, tell them exactly how you feel, tell them how mad you are, but before you leave that conversation, just say I love you, and that is one thing that I know that works, because I see it with those that are dealing with it all the time. They'll see me a couple of years later and say, I remember when you told me. You were the only cop that ever told me that I love you. And, and I think that's huge. Just, those 3 words are more powerful than most medications. So,
especially at the right moment.
Yeah.
Dr. Michael.
I want to echo what you're saying, which is, love the person, hate the disease. That's fine. Love the person, hate the disease. I also want to make sure people are aware that treatment is readily available in our community. There's kind of this, urban legend that you can't get into treatment. There are long waiting lists. And for some treatments out in Berkshire County, we're having challenges. For the treatment of opioid use disorder, you can get immediate treatment. If it's 3 a.m., you can go to the emergency department in North Adams, Pittsfield, Great Barrington, and you can start treatment. It's all set up. It's the law, and we're doing it. If it's a regular workday, you're welcome to call the Breen Center. We do same day, next day access. On weekends, we can get you connected. Spectrum, which is available for methadone, has very quick access. There are other Suboxone programs in the community that do that. We recognize it's a medical emergency, because every day we're not treating someone. Someone could be using, overdosing, dying. And so, maybe if we were talking 15 years ago, there were waiting lists or people had to wait to come in. Now it's like this. You want help, you can get it 24/7. And people really need to know that in our community.
Yeah, that's really great information to hear.
And I think it's important, too, that people understand when you are stigmatizing people, that could be possibly life-threatening, because you're preventing somebody from seeking treatment because that now you've made them feel like they're not worthy.
So I can't back a couple steps. Right?
Yeah, I can't emphasize enough to get educated, understand, and have compassion. I also want to mention that the people who are suffering around them, it's not just the person who's suffering from the opiate disorder. It's also the people who care about them, who want better for them. And there's, as Dr. Michaels mentioned, Learn to Cope is a great organization in providing support for that. They should reach out to them. They can do that. And I think it's important for all of us to not be afraid to call out people when they are, part of the stigma problem. I'm quite adamant about that, and I will call people out, whether in person or on social media, whatever the case may be. And I understand it can be very frustrating, as having dealt with family members. It gets difficult, but it's not helpful when all you're hearing people talk. You got to do tough love. Tough love doesn't work. You need to be compassionate and sensitive and help them.
And Brian and Sarah, just a quick, maybe some prevention tips or takeaways for people to keep in mind, delaying exposure, things like that. Are there any quick observations you can give to the viewing public to help with that?
Well, I'll start. The part of Healing's community, one of the goals is educating the medical providers on safe prescribing. And I think a lot has been done in the community through Dr. Michaels and the Breen Center already, and doctors are much better than they were. And actually in Massachusetts, I know since 2019, I think we're down 40% in the amount of prescription opiates that are being prescribed. But also being your own advocate. There's a lot of people that need to think about when they may be prescribed opiates, that maybe there's another way they can go, whether it be Tylenol or another medication. Making sure that when you do have leftover prescriptions, that you dispose of them properly. There's a number of ways you can do that. I believe the police department still has a box at their station. You can bring them there and dispose of it that way, but don't leave them around. And I unfortunately saw that happen to somebody who would reach out to people and say, my back's really hurting me today. Can you give me any of your leftover prescription? that's not good. So, preventative is let's not share those prescriptions that we have access to, and get educated on the signs of overuse so that we can, hopefully stop somebody from going down that road.
Yeah, we all have a role to play here. And I think that's
Absolutely.
one of the things that's come out in our discussion today, right? As much as all of you know a little piece of all of that, the public at home needs to also know that they have a role to fill as well. Mayor Tyre, would you like to have any closing remarks?
Yes, thank you, Sean. First of all, thank you to all of you for your willingness to have this conversation with us today. It's really important for us to share this information so that the community knows that there is so much help out there if anyone needs it. And I think in closing, the idea that there is this collective, that we're not in silos anymore. There's a collective really working to try to provide this type of care to the people of our community. And as we move forward, I think it's something that we can be proud of. We have had people who have had really a difficult time, but we now have this opportunity right here in our own city where we can provide this type of care to individuals and to families who need it. So this has been, I've learned a lot being part of the conversation today, and I hope that the viewers learn a lot as well and feel comfortable and confident now to reach out when they need help.
Agreed, and I want to thank you, Mayor Tyre, and your office for organizing this today and allowing PCTV to be the conduit for the information. I hope that our viewers have gotten something out of this and learned a few things just like we have here today on the dais. So again, thank you to Mayor Tyre, Dr. Jennifer Michaels, Brian Andrews, Raymond Hernandez, Officer Darren Derby, Andy Camby, and Sarah DeJesus. I want to thank you all for being here today. And for PCTV, I'm Sean Sayre. Thanks again for joining us, and have a great day.